Obesity begins to be a growing problem in Missouri and Illinois and across the United States. We all know that diet, lack of exercise can play a big part, but scientists are unlocking some information that could affect and help millions of people. Very few people may know about this. Joining us now to talk more about lipedema is Dr. Thomas Wright with the Laser Lipo and Vein Center and his patient, Sarah Brashear. Thanks so much for being with us.
You're welcome.
Dr. Wright, let's start with you. Not everybody has success with diet and exercise.
That's right.
And so if they come to you and you diagnose lipedema, what does that mean?
Well, lipedema is a fat disorder that's commonly confused with obesity, which is much more common. But lipedema is a type of fat accumulation. It tends to accumulate in the legs, and it is a type of fat disorder that does not respond to diet and exercise.
So what is the treatment then for patients such as Sarah who came to see you?
Well, the treatment is first conservative treatment, which involves compression and manual lymph drainage to help the lymphatics flow, to help that may help with the riddance of fat, and then finally liposuction, or it's a special type of lymph-sparing liposuction.
All right, Sarah Brashear, tell us about your journey. Did diet, exercise work for you, and when did you finally realize you got to do something else?
About 10 years ago, I was one of those people that wouldn't gain just 5 or 10 pounds, I'd gain 20 or 30. It would never be in the upper extremities above my waist, it was always below hip and thigh area. I dieted, I exercised, I went to all different kinds of doctors to see what was going on. And just through pure research on my own, was I able to find out that what I had was just not plain old fat. And I was able to seek out Dr. Wright, who helped me on my journey to get to where I am now.
And where are you now, and how has it been successful?
I would never be able to do what I do today. I own a bakery and catering company, and I was losing my mobility. I've had 3 procedures with Dr. Wright, and we've moved about 26 liters of diseased tissue and fluid since we've done this and within the last year or so. And I can walk stairs, I can do more than 1.5 miles, 2 miles at a time, steadily walking. I can be on my feet 8 and 10, 12 hours a day, whereas before I was losing the ability to do that.
Dr. Wright, how is lipedema diagnosed? Some people may live with it and not know they have it.
Well, that's a great question. So the lipedema has characteristic accumulation of fat. So it almost exclusively occurs in women, and it accumulates around their hips, thighs, calves, and ankles. And so it's this abnormal accumulation is one of the key principles for how we diagnose it.
And then you mentioned, are there different treatments, an option of alternate treatments?
Right. There's a various diet and conservative treatments, but it doesn't really respond to diet per se, not weight loss diet. It just responds to a low inflammation diet, and because this fat actually can become tender and painful.
How often does a patient need treatments? Is it just a once and for all kind of thing, or is it continuing for a while?
So we've been treating this with liposuction, and people have remarkable improvements that last 10, 15 years. That's as far as we can say at this time.
Okay, all right. Dr. Thomas Wright with the Laser Lipo and Vein Center, and patient Sarah Brashear. Sarah, thanks so much. Good luck to you. Dr. Wright, good seeing you.
Thank you very much.
Thank you very much for being with us. We appreciate it. Let's send it back to Chandria.